Hi, so my name is Sydney Reeves, and it's the 26th of October. So for the skeletal system presentation, I'm going to start with the main components of the skeletal system. So starting with like your ligaments and your tendons. So your ligaments are going to be, ligaments and tendons themselves are essential to our movement. They help our body move. They help us do like flex and extend our muscles. But your ligaments are going to be your fibrous connective tissue that connects bones to bones and then helps hold them together. But your tendons are also fibrous connective tissue, but they attach the muscles to the bone instead of like bone-to-bone contact. So then those are two main components of the skeletal system. And then obviously like the bones themselves. And then your vertebrae are going to be very important, knowing like your cranial, your thoracic, your lumbar, and your sacral area is going to be very, like that's a big deal. And then your skull itself, knowing all the different bones that go into all of the skull. And then your hyoid bone, which is going to sit kind of right under your jaw, right here. It's not connected to anything like any other bones. And then your synovial like joints, and then just joints themselves, kind of that helps you bend and move and run. And then the cartilage within those joints. And then your pelvic girdle, which is going to be like your hip, your ball and socket joint, kind of this whole area. And then your upper and lower limbs, your humerus, your ulna, your radius, your femur, your tibia, and your fibula. So then going into the bone classification, so you have long bones, which are going to be kind of your obvious, your humerus, your ulna, your radius, your femur, your tibia, fibula, and then your metacarpals are going to be kind of this area, and then your phalanges in your hand, and then in your foot you're going to have your metatarsals, and then your phalanges in your foot. They're going to be your long bones. So then your short bones are going to be the carpals, like in your wrist joint, and then the tarsals of your ankle joint. So then the flat bones are going to be like your skull bone, your bones, your scapula, so your shoulder blades, and then your sternum, and then your ribs are going to be flat bones. So then you also have irregular bones, which you can kind of guess, like your jaw is an irregular bone, and then your vertebrae are going to be an irregular. So then talking about the axial, and there's the axial skeleton and the appendicular skeleton. So the axial skeleton is going to be kind of like your upper half, like I like to think of it. So you have your skull itself, and then ossicles are going to be like your inner ear. It's part of the axial skeleton. Your hyoid bone, so right kind of in here. Your rib cage, and then your vertebral column. So all of that. So from your sacrum or your coccyx all the way up is going to be your axial skeleton. So then your appendicular skeleton is going to kind of be the rest. So you have your clavicle, your scapula, and have your humerus here, and then your radius and ulna, and then your carpals kind of right in this area, your metacarpals, and then your phalanges. And then you have your hip bones, which is also your pelvic girdle, and then your femur, your tibia and fibula, and then your tarsals kind of in the top of your foot, ankle joint, and then your metatarsals, and then your phalanges. So kind of your upper and lower limbs are going to be mostly your appendicular skeleton. So then moving up top to like your cranial bones. So I'm going to take his head off here. So you can kind of see the suture lines in your skeletal system, in your skeletal model. So you have your two parietal bones. And then this one right here is going to be your frontal bone. So if it's back on, you have your two parietal, and then your frontal here. And then your ethmoid bone is kind of going to be like in the back, like right in kind of in your eye socket area. And then your sphenoid bone is kind of going to be right in here. And then your temporal bone, if you can see temporal bone. And then right back here where it connects, where your head connects to your atlas, is going to be your occipital bone. So those 8 cranial bones total, which are very important to know, especially when it comes, like if you're in the ER and someone comes in with a broken nose, knowing kind of the structure there, especially when it's close to the eye, knowing the occipital or the orbital eye, like orbital bones area. And then if someone has an injury in their vertebrae, knowing, okay, is it up top in the cranial location? Can that be harmful to like their skull and their brain, and kind of all the different things that can cascade after that. A big example that I kind of thought of when it comes to like what I would like to be doing in my future career, because I want to be a nurse, I would like to be a circulator in like the OR. But knowing like rib placement, to know, okay, we're having surgery on the kidney, we need to know what's in the area around it. If they're having their like a TKA, which is a total knee acetabular, knowing it's going to be their knee. And then, just knowing the organs associated with the rib location, like you have your 2 floating ribs, which are going to be considered probably part of your, like right in the middle of at the end of thoracic and start of the lumbar vertebrae. So knowing, okay, if someone was in a car accident and they think they broke a rib, could they have punctured a lung? Could they have harmed a kidney or just an organ in that area? And then also like knowing your auscultation zones and your intercostal space, like for your ribs, knowing what you're listening to or which areas, if you're like listening on the back, if you're listening on the front, knowing kind of count your ribs to know kind of where you're located at. So I think that would be very beneficial for like my future career, but that's all. So thank you.